Today, we're getting into something really important: the state of digital health in South Africa.
It's a huge topic, definitely. We've looked at insights from all sorts of people, academics, government officials, folks in the private sector, NGOs.
Right, a real cross-section. And our goal here is to give you, the learner, a clear picture: the policies, the standards, the systems on the ground, and, well, what's working and what isn't.
It's about understanding the complexity, the ambition versus the reality, really, how technology adoption plays out of these big, complex systems.
Exactly. It's a fascinating case study, and hopefully we can break it down without drowning you in jargon. Okay, so where do we start? The policy landscape.
Sounds good. So there's the National Digital Health Strategy. Initially, people seemed quite positive about it.
Because it was developed with consultation, right? Getting input.
That was the feeling, yeah, that
Mhm.
people had been consulted, which is always a good sign, you know?
Sure, but I sense a but coming.
Well, yes. As people looked closer, concerns started popping up, mainly about feasibility.
Feasibility, like, can it actually be done with the resources available?
Exactly. The resources, the existing infrastructure across the country.
Right.
Some felt the milestones, especially for a 5-year plan, were just maybe a bit too ambitious.
Okay, ambitious. So a big vision may be lacking the practical steps.
That's a common view. It's seen as this high-level vision document, which is needed, of course, but it's maybe short on the detailed guidance.
The nitty-gritty.
Right, like costed work plans, clear timelines, the stuff you actually need to make it happen effectively on the ground. Without that, it risks staying, well, just a vision.
And I guess that ground looks different depending on where you are in South Africa.
Absolutely. The provinces vary hugely
Hmm.
in capacity, infrastructure needs. So this idea of a one-size-fits-all national strategy,
Yeah.
it just won't work.
So provinces need to take that national strategy and really tailor it.
Precisely. They need the flexibility to adapt it to their specific context, their resources.
Okay, so a national strategy needing more detail and local adaptation. Now, for any of this digital stuff to work together, you need common rules, right? Standards.
Exactly. And that brings us to the Health Normative Standards Framework, the HNSF.
HNSF.
This was put together by the CSIR, the Council for Scientific and Industrial Research, working with the National Department of Health.
And the goal is?
The main goal is interoperability, making sure all these different digital health systems can actually, talk to each other. It sets out the prescribed norms for that.
Interoperability. That's the magic word to avoid those islands of data we always hear about. Why is that so vital?
Well, for patients, it means their information can follow them securely, better decisions, less duplicated tests, smoother care.
Mm-hmm.
And for clinicians, it means having a more complete picture right there when they need it, regardless of where the patient was seen before. A huge potential benefit.
Definitely. A connected view of the patient's journey. Was this HNSF developed by looking outwards at what others have done?
Yes, very much so. The CSIR helped look at international best practices. The idea was to learn from elsewhere, but adapt it for South Africa.
Smart. And who has to follow these rules? Just the government hospitals?
No, the intention is broad. It's supposed to apply to all health information systems. Public sector, private sector, everyone.
Oh, interesting. Even private clinics and hospitals.
That's the aim. Part of the reason is to try and curb what's called vendor lock-in.
Ah, where you get stuck with one company's tech and can't easily switch or connect to others?
Exactly. The HNSF tries to push for a more open environment where systems can integrate, regardless of who made them.
So the government's trying to facilitate this, talking to the private sector.
Yes, there's been engagement involving the government, private health sector, and the CSIR. It's about finding that balance, setting necessary standards, but also considering the economic side and everyone's needs.
A tricky balance, I imagine. But is the HNSF, like, finished? Are all the standards needed actually in place?
That's a key point.
Mm.
It's widely seen as still being incomplete. People acknowledge, we don't have all the standards that we need yet.
So it's a foundation, but still under construction.
You could say that. And some critics go a bit further, describing it in its current state as maybe just a shopping list of standards.
A shopping list, meaning?
Meaning it identifies what standards are needed, but maybe doesn't provide enough practical architectural guidance or, crucially, implementation support to really help organizations adopt them effectively.
Okay, so we've got a policy needing detail and standards needing more substance and support. How does this translate to the actual digital systems being used out there? What's the reality?
Well, the big picture, especially in the public sector, is pretty slow progress towards having proper Unified Electronic Health Records, or EHRs.
So that dream of a doctor pulling up a patient's full history instantly, still mostly a dream in public facilities.
Largely, yes. Many systems in the public sector are more like patient administration systems, handling registrations, appointments, basic demographics, or they're for billing.
Okay.
Or sometimes they're just used for back capturing paper records after the fact. They aren't really the dynamic EHRs clinicians can use during a consultation to guide care.
So more admin focused than clinical support focused.
That's a fair distinction, yeah. Now, the private sector is a bit different. Digitization is generally higher there.
Right.
You do find more sophisticated EHRs sometimes, think like orthodontists or specialized areas. But the big issue there is integration between providers. It's often quite low.
Ah, so even with better systems, they're still operating as separate islands.
Pretty much. Where you do see integration is often at the funder level, the medical aids.
How so?
Well, a big funder, say Discovery, can get submitted data from lots of different private providers and analyze it for, public health trends or managing costs. But that's different from Dr. Smith easily seeing notes from Dr. Jones.
Got it. Integration for oversight, not necessarily for seamless clinical care between different places. And haven't there been attempts to roll out big EHR systems before that didn't quite work out?
Yes, definitely. There have been past efforts and some well-known struggles. Gauteng province, for example, has had several initiatives over the years trying to implement comprehensive EHRs that faced, significant challenges and didn't really hit their goals.
Learning experiences, hopefully. And you mentioned the lack of agreed standards being a blocker.
A huge one. In many provinces, just getting agreement on the basic data standards has really stalled progress on making systems interoperable. If you can't agree on the language, it's hard to have a conversation.
Makes sense. And it's not just the tech, is it? What about the people using it or the companies implementing it?
That's absolutely critical. There have been experiences where international firms came in to implement systems, but they lacked a deep understanding of the South African healthcare context.
Like what kind of context?
Well, things like really long patient waiting times or the
Yeah.
specific workflows in a very busy public clinic or emergency room. If the system isn't designed with those realities in mind, staff just won't use it effectively. It doesn't fit.
So the tech has to fit the reality, not the other way around. Okay, let's talk specifics. What are some of the main digital systems actually running nationally and provincially?
Okay, nationally, there are several key ones. There's the DHIS, or DHIS2, the District Health Information System. That's crucial for collecting and reporting health data nationwide.
Right, I heard of that.
Then you have Tier.net, which focuses on managing data for specific diseases like HIV and TB. There's the Health Patient Registration System, aiming for that unique patient identifier.
The holy grail of patient identification.
Indeed. And then, very visibly, the Electronic Vaccination Data System, the EVDS, from the COVID-19 response.
Ah, yes, the EVDS. That was generally seen as a big success, wasn't it? Considering the pressure.
It really was a significant national achievement, rolled out quickly to millions. It also showed how vital good change management and user training are when you introduce something new on that scale.
Good point. Are these national systems all neatly connected?
Well, the National Department of Health manages about a dozen national systems, often with the CSIR's help.
But
And there are attempts to integrate them, like linking the TB register data into THERE. But it's challenging. Data migration between different platforms can be tricky, and sometimes there just isn't enough technical support down at the provincial or district level to manage it all smoothly.
so the will is there, but the execution hits bumps. What about provincially? Big differences there.
Huge differences. And this is where the Western Cape really stands out. It's often held up as a success story.
Why is that? What have they done differently?
It's been a long game for them. Over 20 years, they've systematically built up a coordinated digital health ecosystem.
20 years. That's sustained effort. What systems did they put in place?
They started with Clinicom in hospitals, initially more admin-focused, but serving as a patient master index. Then they added a province-wide pharmacy system, a billing system linked to Clinicom.
Building block.
Exactly. Then, importantly, they developed their own primary healthcare clinical information system, specifically for capturing clinical notes during consultations in clinics.
Ah, so designed for the clinical workflow.
Yes. And they linked other systems too: forensic pathology, mortuary, emergency medical services, the radiology PACS systems, all designed to work together.
That sounds incredibly comprehensive. What's the result?
The result is a far more coherent provincial health record. They can link clinical data, lab results from the national labs, reporting data for DHIS2, data for specific campaigns like HIV.
So they can actually track patients across different services and over time.
Yes, much more effectively. They can monitor public health trends, manage care pathways. It gives them a much clearer picture of what's happening health-wise in the province.
The contrast must be striking. You mentioned Gauteng earlier.
Right. The comparison often made is, Western Cape has EHRs implemented in 54 out of its 55 hospitals.
Wow.
Gauteng, with 37 hospitals, was reported as having EHRs in only 2.
2 versus 54. That really underscores the difference in progress.
It certainly does. It shows what's possible with sustained focus and investment.
Okay, so the Western Cape provides a hopeful example. Based on all the successes, the struggles, what are the make-or-break factors for getting EHRs implemented effectively?
Several big themes come up again and again in the insights we looked at. First up is leadership.
Absolutely crucial, I'd imagine.
Totally. You need strong, consistent leadership. Buy-in from the very top, right down through the system. People who understand the sheer scale of this, who champion it, and foster collaboration over the long haul.
And without that?
Without that high-level buy-in, support waivers, funding might get diverted, progress stalls. There are also concerns sometimes raised about politically motivated appointments, maybe hindering continuity or expertise. And even internal conflicts within departments can unfortunately get in the way.
So stable, committed, knowledgeable leadership is paramount. What's next?
Skills and expertise. Capacity building is just essential.
Having the people who know how to build, run, and use these systems.
Exactly. The skills often exist, maybe in the private sector or NGOs, but there's a real gap in government. Budget constraints make it hard to hire the right IT people.
And keeping them.
That too. Public sector pay scales might not compete, and sometimes the environment can be challenging. There's a definite need for specialized job categories for health IT folks.
And involving doctors and nurses.
Critically important. Getting clinicians involved in design and implementation roles, like a chief medical information officer, makes systems much more likely to be useful and adopted. And basic training for all healthcare workers, even just computer literacy, plus ongoing training on the specific systems. It's fundamental.
You can't underestimate the human factor.
Never. And that includes things like awareness around data privacy and security. That's a huge challenge, often driven by just lack of awareness among staff.
Okay, leadership, skills. What about the tangible stuff, the money and the wires?
Right. Resources, funding, and infrastructure. This needs serious, sustained investment.
We're talking hardware, software, connectivity.
All of it. Infrastructure is a big one. Getting reliable internet, especially fiber optic, out to all facilities. Relying on contracts with private providers can lead to issues, patchy service. Something like 40% of public facilities reportedly lack reliable internet.
40%, wow.
Yeah, and there are huge geographical differences too. Then there's just not enough money for hardware, software, maintenance. Sometimes you get hardware delivered but no software to run on it, or vice versa. Even theft of equipment is an issue.
And storing all this data.
Another challenge. There's reliance on cloud services, which has its own complexities. Many feel there's a need for a more central national data repository rather than data being fragmented across provinces and departments.
So better planning needed.
Definitely. Proper situational analysis first. Phased implementation with realistic costed work plans. And, crucially, leveraging what's already there.
Like the EVDS.
Exactly. Build on successes. Prioritize interoperability so systems can talk, rather than chasing the fanciest, most expensive new thing. Use the infrastructure you have before adding more complexity.
Makes sense. Smart investment. Okay, last big factor.
Governance. This covers how the whole effort is managed and overseen.
Alignment between national and provinces.
That's critical. A shared vision and coordinated action. One issue highlighted is that the national department doesn't always have strong financial levers to influence what provinces prioritize or how they spend funds.
Ah, okay. And procurement, the tender system.
That comes up a lot. There are perceptions, sometimes based on past issues, that the tender system can be open to abuse, isn't monitored well enough, and doesn't always select the most capable partner.
Trust issues.
Yes, which can then make collaboration harder. Some also feel the process can be too rigid, preventing partnerships with known, reliable entities if they don't fit the exact tender spec. So integrity, transparency, expert input into procurement, all vital.
So leadership, skills, resources, and governance. It's a complex web. It feels like South Africa has many of the ingredients, resources, expertise, more so than many neighbors, perhaps.
It does, yes. More resources, more stakeholders, private sector, universities, NGOs. But paradoxically, that richness can also lead to fragmentation.
How so?
You end up with lots of parallel systems, sometimes competing, often developed in silos.
Silos again? Driven by funding, maybe?
Historically, yes. Funding often came for specific diseases, HIV, TB. So digital solutions were built for those specific needs without strong central coordination pushing for integration from the start.
And national leadership efforts have struggled.
Attempts have been made, but sometimes weakened by, well, internal power dynamics or changes in leadership.
Yeah.
And that lack of trust we mentioned between the public and private health sectors, that really hinders potential partnerships, even though the private sector has skills and tech that could be valuable.
So bridging those gaps, building trust, fostering collaboration seems key.
Absolutely. Between policymakers, researchers, community members, public, private, everyone needs to be part of the conversation.
When countries try to implement this kind of national system, are there different ways they go about it?
Broadly, you see two main approaches. There's the very top-down way, design the grand strategy first, then implement everything according to the plan.
Okay.
And then there's a more bottom-up or perhaps evolutionary approach. Systems develop more organically based on local needs, but with a strong emphasis right from the start on making sure they can interoperate, can connect. The national strategy then kind of evolves alongside the implementation.
And which works better?
Interestingly, many countries that have made good progress seem to have followed that more bottom-up evolutionary path, allowing innovation but insisting on connection.
So for South Africa, maybe the path forward isn't trying to build one giant system overnight.
Perhaps not. It might be more pragmatic, more achievable to build on the systems that are working, like the EVDS example. Focus hard on making existing and new systems interoperable. Add modules gradually. Let it grow more organically, but within that framework of standards.
This has been incredibly illuminating. If we were to boil it down, what are the main takeaways from this deep dive into South Africa's digital health journey?
I'd say first, South Africa have policies and frameworks, but translating them into a truly national working EHR system faces major hurdles.
Right.
Second, those hurdles span leadership commitment, skills gaps, resource and infrastructure deficits, and complex governance issues, including trust. Third, the Western Cape shows what's possible with sustained effort and a coordinated approach over many years. It offers a valuable, albeit long-term model.
Okay.
And finally, perhaps the most practical path forward involves leveraging existing successes, really doubling down on interoperability standards, and maybe favoring gradual modular expansion over trying to build everything at once.
Really clear point. So, for you, the learner, listening to all this, the challenges, the Western Cape story, the broader context, here's something to ponder. What single factor do you think South Africa needs to prioritize most right now to really kickstart progress towards that national digital health ecosystem? And if they did focus intensely on that one thing, what might be the less obvious, perhaps unexpected ripple effects? Definitely some food for thought there. Thanks for joining us for this deep dive.